Hello everyone, this is Rebecca, occupational therapist, and this is Dementia Masters, where I teach you everything you need to know about dementia so you can master it yourself. Today's subject is, what stage is my loved one in? And this is always a hot topic because our doctors talk in stages and they tell us they might be in a stage 3, which might give us some inkling of something, might be in the middle, but other than that, they don't give us any information really about what to expect next, how long are these stages, all that type of information. So I hope you guys learned something today, and I'll see you at the end.
So we are going to learn what are the stages of dementia, how long does it last, and what to expect along the way. So let's start off with saying that I am Rebecca. I am an occupational therapist, and I am not a doctor, so I don't diagnose dementia. But I work with the holistic part of dementia, and I've worked with people for over 10 years, families and patients with dementia, and I created my own dementia program in the nursing homes. I also was a personal caregiver to my father before his passing with a disease causing dementia. So I definitely have my background in dementia. Oh, and I forgot to add that I was a family social worker well before I got my degree in occupational therapy. So let's get on with this information. Is knowing what stage your loved one is in important? I think yes and no. Yes, it will help you prepare and understand what may happen in the future. And it will help you see when changes in stages may be happening. But it will not change what their individual day-to-day needs are. So having a number doesn't really totally help, but understanding what people are talking about, the professionals, kind of keeps you in the loop and gets you to understand what's going on. And each person and disease is different, so there is no clear-cut stage. I will definitely tell you that. So let's talk about what is dementia. Dementia is not a specific disease itself, but rather a collection of symptoms caused by various underlying conditions or diseases that affect the brain. So it's an umbrella term of all the different symptoms that there are caused by the diseases that are going on in the brain, such as a decline in memory, reasoning, thinking, and problem solving. And then there's also behavioral and psychological symptoms of dementia, such as agitation, aggression, apathy, psychosis, and depression. And then there's also a decline in the sensory system, such as visual impairments, auditory changes, loss of taste and smell, tactile sensations, and perceptual deficits. So if they become severe enough, they will interfere with a person's daily functioning. And they can happen at different times in different stages. And because the diseases are different, the brain is affected differently. So one might come up quicker than the other. Some people that have Parkinson's may have physical difficulties, but may not have the delusions or may not have lost their cognitive abilities yet. So it's all different. But there are over 400 different types of diseases or conditions that cause symptoms of dementia. So Alzheimer's, everything's usually talked about Alzheimer's because it's 60 to 80% of the people that have dementia is Alzheimer's. Then we have vascular dementia, which is next, 20 to 30%. Lewy body dementia, 10 to 25%. Frontal lobe or Pick's disease, 10 to 15%. Parkinson's, 10 to 15%, and other. So getting a diagnosis is important and helpful because the treatment or the understanding can change things. And so important things to remember. Stages and changes can happen at different times of the disease. And they will come and go and possibly return. So you think it might be over, but it could come back in a month or so. And if you see one thing, it does not mean they are automatically in that specific stage. It's kind of a combination of things, and it's consistent. So if you see it once, but it hasn't happened in weeks, then it might be that they're edging towards that way, but it doesn't mean that they're exactly in this stage. And we have to look at the whole person and the whole environment and everything that's going on. There's a big difference between someone that has dementia that is being cared for at home with good care compared to someone with nursing home care that is not paid attention to and that is not actively engaged with their brain. So we have to look at the person holistically at what stage they're in based off of what is going on around them as well. So when our loved one is taking these tests, we use an interview or more of a questionnaire with different cognitive challenges and with possibly writing something or usually drawing a clock or shapes. So it's important to remember and consider factors while we're giving these interviews and these tests. We have to consider their educational history, if there's any learning disabilities. This is a key one that wasn't considered when these assessments were made. And I have a learning disability. I have diagnosed dyslexia and ADD and some sensory issues. And later on, I could tell when I've done some of these tests, I didn't score the best, but I also got straight A's getting my master's degree. So these tests are not completely definitive. The next one is hearing abilities. Is someone wearing their hearing aids? Were their ears cleaned? Have they, been going without hearing aids for a long time and they kind of pretend that they can hear what you're saying? And language. What's their language currently? Is there a language barrier and they don't understand what you're saying? Maybe the person who's giving the interview has an accent or difficult to understand, which is difficult for that person to understand that's trying to pass the test. And same back and forth. Maybe that person doesn't understand exactly the words you're asking of them. And again, next is the surroundings. Surroundings are also very important. People with dementia are easily distracted. So if you have someone facing a window or someone that is in the dining hall with other people noises going on, or you think that you have, the patient in the corner, but there's a whole entire therapy gym actually going on, and we might not be distracted, but that person can certainly be distracted. And another thing to consider is medications. What medications are they on, and when did they take them? Because if we're doing an interview with someone that has had a hip replacement from a fall, and now they're in their nursing home, and they've been there for 2 days, are they on a really high dose of pain medication that's getting them confused? Or did they end up in the nursing home because they forgot to take their certain medication and now they've kind of deteriorated? And so now they have to go back on their thyroid medicine or something like that in order to get back up cognitively. So these are many things to consider that I have seen personally. Some people don't. So when there is a definitive number that's given, also take into account when was this interview done. I have seen poor social workers give an interview to a woman many times, different ones, but this particular woman was sitting in her Johnny without her dentures in, just recently had medication because she did have that hip replacement, and the social worker had her in the corner of the dining hall. People are going by, people are putting china or dishes down and stuff like that. So I know that there's little room at times in nursing homes, but it's very important to have a good solid location and really understand what you're doing to this person and making sure they are at their best level when you are going through these questions, because it could change in a week or two, and you don't want to be diagnosed as incompetent or unable to care for yourself or unable to sign for yourself when or told to us as caregivers, that we need to do 24-hour care and this person can't take care of themselves. It might only be for 2 to 3 weeks or a month. And I have another example of a woman who did forget to take her thyroid medicine. She ended up passed out in her home and someone had found her. She made it to the hospital. They did what they needed to do. She ended up at the nursing home. But because she only had a niece left in her life that lived far away, the social workers and everybody did their testing and came out with that she had dementia. And so what her niece did was she sold her home, she helped pay for the nursing home, and I can tell you within 3 months, and it did take 3 months, this woman was back to par. She would have been able to care for herself. She would have been able to, if she needed reminders, or someone would have been able to set up home health-wise, and she wouldn't have had to live in the nursing home. So it's very, very important to take assessments with a grain of salt. So don't worry, I am going to attach these assessments and one of the questionnaires that we use, just so you don't have to keep a squinty eye on my screen, and then you can look at it and keep it and understand it. So some things to consider about these assessments that I'm going to talk about is that they were made in 1980 and 1983, and things have changed, but the assessments and scales, Alzheimer's and any association has not changed any of the scales. Not that they really need to be changed, but there is some more things to think about, like a learning disability or other things that could happen or be involved and that aren't thought about back in the 80s. So something to think about. And let's say if there's no clear consensus of assessments used worldwide. The functional assessment staging test is separated into 16 stages, and the global deterioration scale is separated into 7 stages. And they're generally the same, and they were both developed by Dr. Barry Reisberg. And he the first one, he kind of got more in a deeper dive of things, and then the other one, he kind of simplified things. And I'm going to go back and forth between the two of them. Both of the scales provide caregivers an overview of the stages of cognitive function for those suffering from a primary degenerative dementia such as Alzheimer's. So it gives the caregivers an overview. Both are broken down into 7 different stages. Stages 1 through 3 are the pre-dementia stages. Stages 4 through 7 are the dementia stages. And beginning at stage 5, an individual can no longer survive without assistance. So the Global Deterioration Scale provides more detail, while the Functional Assessment Staging Tests gives us an expected duration of being in that stage. How long are we in that stage? Is it 5 months? Is it 2 years? How long are these stages lasting? And they're different amongst each stage. It also gives us the mental age of the person. So when someone's in the different stages, our brain is deteriorating, which means our mental age is deteriorating as well. We physically might not be deteriorating, or we physically are, but we don't look like we're getting younger, but our brain is kind of getting younger in a sense. And the Functional Assessment Staging Test is considered, and I quote, the most validated measure of the course of Alzheimer's disease published in scientific literature. So pretty much everybody goes by this. So why is knowing the mental age important? You can give yourself a better understanding of your loved one's mental level, which gives you a better understanding when you're talking to them or when you're doing things with them. You can step back and say, oh, they're not really the 82-year-old I'm looking at. Their brain is processing at a 12-year-old or an 8-year-old. So that's important. And next is that we can modify the difficulty of the task while still providing a sense of independence. And we do that for our children. You know, they are brushing their teeth and we want them to do all the steps, but maybe we supervise or we set it up for them. And we can communicate at their level. Again, better way of communicating. This is what I do during my dementia program and other things. But currently, their level of understanding is very important for you to get through the information that you want to get through. And you can create the activities at their level to keep their brain and body active. You know, we don't expect our 8-year-old son to pay the bills or make the table, but we can expect them to make the table with some supervision or some setup or giving them cues, but still making them feel independent and happy and that they are helping. So that's why that's important. You can you can explain this information to your paid caregivers. That is very important because especially in nursing homes and in just having a paid caregiver that comes in, some people are not, they're not educated in dementia. They don't know anything. Some states require 2 hours, of education each year. And that is so little education. You can't even get 2 hours worth of anything, stuck in your brain and actually work with somebody. So something to remember, and this is why you have to do the training. And you can reduce behaviors by understanding this. If you're at their level and you are providing the best care you can, guess what? The behaviors will go down. So next, with the functional assessment staging test, I am going to flip-flop between the purple and the blue. Purple is going to be the functional assessment staging test, and the blue is going to be the global deterioration scale. And I'm going to go through them and we'll talk about those. All right, so let's talk about the assessments. The functional assessment staging test, stage 1. And this is normal aging, there's no deficit seen. And if you look, the duration, this is the one that tells you how long it will last, and the mental age, how old they are. And we see stage 1 as adult. And again, for the global deterioration scale, there's no complaints and there's no memory deficits seen. Stage 2, it's considered mild cognitive impairment, and there's subjective functional deficit, which means the person may see that there's a deficit, but other people don't notice yet. The duration can last as long, and the mental age is adult. And I would say with stage 2, if there's a learning disability going on, ADD or anything else, it could be the cause, just because I personally have seen. So under the global deterioration scale, number 1 for level 2 is forgetting where one has placed familiar objects. I have done that. Forgetting names known well. I've done that a couple of times. There's no evidence of deficit in employment or social situations. But there's a personal concern of forgetting more. So it's kind of getting a little bit personal and you kind of think that there might be something wrong, but you don't say anything out loud. Stage 3, mild cognitive impairment, objective functional deficit. So now other people might be seeing a little bit of a problem. It can interfere with a person's most complex tasks. And that's the duration, this is important, is 7 years. So this, when we think about duration of stages, they last a long time and they get shorter and shorter. But the mental age, if you look at that, it's 12 and older. So even in stage 3, where they haven't even said that there's this is considered pre-dementia, they're at the age level of a 12-year-old or higher. So 12 plus could be 12 to adult. So something to remember. In level 3 with the global deterioration scale, person may have forgotten or lost when traveling to an unfamiliar location. So they might have gotten lost or forgot where they were going. 2, coworkers become aware of person's relatively poor performance. So now people are starting to say, what's going on? Word and name finding deficit becomes evident to close relatives. And so that's important to remember. This is still pre-dementia. So when someone says, oh, mom's in pre-dementia, we're all set, or the doctor says, oh, it's pre-dementia, there's already a problem going on. So that's why I don't like what they classify the scale as, and just food for thought. Number 4, a person may read a passage or a book and retain relatively little material. I would say again, learning disability depends on what the material is, but if it's not facts, then I would forget that too. Number 5, person may demonstrate a decreased ability to remember names upon introduction to new people. So again, I do this as well, especially if I'm distracted and everybody meets at the baseball game, or we're all meeting outside and there's a lot of things going on. I might hear their name, but I would probably have to get a couple reminders. Number 6, a person may have lost or misplaced an object of value. Number 7, concentration deficit may be apparent in intensive clinical testing. Again, as I said, it's difficult for me to concentrate, especially. So I would totally understand. Number 8, decreased performance in demanding employment and social settings. So now people are starting to really see in the demanding part. So sometimes our day job, there's easy parts of the job and then there's harder technical parts of the job. So that harder technical part is getting a lot harder. Same thing with social settings. If we have to sit down and have full-on conversation at dinner or at a wedding or something, then it becomes difficult. If you're just out, shaking your head yes and no and smile and nod, then it's not difficult. Number 9, denial becomes manifest in the person. So that person is starting to realize that there's a problem, but then they're starting to go into denial. This isn't happening to me. I don't want to lose my memory, so this isn't happening. And they don't want to listen to you or anybody else. Number 10, mild to moderate anxiety accompanies these symptoms. We would all be anxious, and there is a lot of anxiety that comes with starting to think that there's something that might be going wrong with you. I would say in any disease, but in this moment, this is what we're talking about. So if we see for level 3, they call it pre-dementia, but there's definitely some things, clear-cut signs of a deficit. So the wording, I feel, is off. So let's go on to stage number 4. So this is the end of stage 3, and this is mild cognitive decline and still pre-dementia. And one of my thoughts, or a couple of my thoughts, is that it is time now to put something in place, to figure out what the plan is and figure out the financial decisions. How can you afford long-term care or someone coming in, or what is the plan of affording it? We don't know when something drastic happens, like a fall. Say somebody not only with the dementia, but has a fall because of the visual impairment or something. Now there's a hip problem. Now what's your next plan? Because it happens quick and then you don't get to make the decisions. If you check out places ahead of time, even if you don't think you're ever going to be there, or even if you don't think it's going to be for 4 to 5 years, it's always good to keep going in and checking the place out. See how it looks. See what different things are. Go to different places because they're all very different. They all are for profit, but they are all very different. But also figuring out who's going to help in the meantime. Who's helping? Is Dad moving in with Sarah and not with Katie? And can they split it 50-50 where, you see Katie for 6 months and then you see Sarah for 6 months? Those types of things. Or figuring out selling the house and maybe putting an in-law apartment on. those types of things, because the financials become very important. Medicaid looks back 7 years, and in most states, or in my state, excuse me, and Medicare does not pay for any type of long-term care unless you're getting short-term rehab, like seeing a therapist, and they try to get you out as quick as possible. They don't pay for it. So understanding and allowing your parents or whomever your loved one is, or yourself, to be able to make those decisions ahead of time, for the whole family to sit down. Even if there's the person that you know that's not going to be able to really participate, have them still sit down and they can do something. On to the next stages. Okay, on to stage 4, which now they still call mild dementia, but IADLs become affected. And an IADL is an instrumental of activities of daily living, things that we do that are not the main part of living, but the instrumental things, the bill paying, cooking, traveling, those things that are kind of accessory needed in order to survive and make it out in the community. So those become affected. This duration of this is 2 years, and so it's a shorter duration during this compared to last assessment or last stage, which was 7 years. The mental age is between 8 and 12 years old. So remember, when you're asking dad to take care of mom and they're getting frustrated with each other, it's because mom is acting like an 8-year-old. Or if you're angry with mom because she's acting like an 8-year-old, it's because mentally she is an 8-year-old, and that's what has happened to her brain. So remembering just to keep that in mind when you get so upset and lose your patience. Level 4 with the global deterioration scale. Mild dementia still, decreased knowledge of current and recent events. Not remember of going to Sally's birthday, or not remembering such and such's wedding. Number 2, may exhibit some deficit in memory in one's personal history. And that's might be like, where did they graduate from high school, or where did they grow up? Usually past history sticks around more than short-term memory. Difficulty concentrating on serial subtractions, minusing 7s from 50. I would say I still would have a hard time with that, just because, anyways. Decreased ability to handle finances, cooking and traveling. We've already talked about that part. But they still have a lot of things that they can do. And they are still orientated to time and place. They still recognition of familiar persons and faces. And they still have the ability to travel to familiar locations and perform most complex tasks. And complex, meaning being able to do the sequencing for their dressing. They might have difficulty doing their bills necessarily because of the subtraction and the organization of it, but they can still do most of their stuff. But denial is dominant in the defense mechanism. Obviously, we would all be angry and denying what's going on. And flattening of affect with withdrawal from challenging situations frequently occur. So flattening of affect is just feeling down. We all would feel down, and maybe not getting outside, getting enough sunshine, and withdraw from challenging situations. We would do that too, because we don't want to be embarrassed. If we were an engineer and suddenly we can't have a conversation with somebody, we would feel embarrassed, or we don't remember their name. And naturally, we begin to avoid these situations. So stage 5, finally got to moderate dementia. And I would say actually for stage 4 and stuff, this is important to start making schedules and keeping things consistent and making things the very same, because the more of the same things are, more consistency someone has with dementia, the better they are off, and the more activities and all that type of stuff. But anyways, stage 5, moderate dementia, needs help selecting proper attire. So now they could still get dressed, but they are confused with making that organizational idea or thought process. Duration can last 1.5 years. Mental age between 5 and 7. And so we see this, how would you speak to a 5-year-old? How would you adapt any situations to the 5-year-old? Are you going to continue to entertain the 5-year-old because they need entertainment, and so does someone with dementia? Their brain still needs to be activated. So back to the global deterioration scale. A person can no longer survive without some assistance, so they need someone to help them out with most situations. 1, person is unable to recall a major relevant aspect of their current lives, maybe their address, telephone number, close family friends. So those are all things that start to deteriorate. Frequently, some disorientation to time, date, day of week, season, or place. So time and date, half the day of week, if I'm on vacation, I forget the day of week. So if someone's not on a schedule, then they would forget this day of week, and that's why we need schedules. 3, an educated person may have difficulty counting back from 40 by 4s or from 20 by 2s. So easier math problems, more difficulty. Number 4, persons at this stage retain knowledge of major facts regarding themselves and others. So they're still remembering, major things that happened, wedding, marriage, that type of stuff. They always know their own names and generally know their spouses' and children's names. So they know, and they're still nodding and shaking yes, and they think that those are familiar. Knowing a name, familiarity, compared to being able to speak it and say it is 2 different things. Number 6, they require no assistance with toileting and eating, but may have difficulty choosing the proper clothing wear. So again, they still have that old sequence that they've learned since they've been 5 years old, how to make it to the bathroom, but the organization of the clothing might be a bit difficult. All right, so that's good one. Number 5. This, we definitely should have a plan in place. There should be definitely decisions made before someone's thought to be incompetent, and the whole family should really, really get together. Some people might not be able to help physically, but they can help maybe do other things, organize things, do research. There's so much research that needs to be done. Just everybody should understand the disease, know where your loved one's at, because it makes it so much better. It doesn't help if you tiptoe around it, because it's still going to come to a point where now nobody wants to make a decision, and then it's going to fall on one person. I've been there, done that. Okay, so let's go on to stage 6. Now, remember when I said the functional assessment staging scale was separated into 17 different pieces, and this is where 6 and 7 get separated into smaller pieces, 6A, B, C. And if you remember, this assessment was done first in 1980, and then the doctor kind of skimmed it down and just turned it into 5, 6, 7, that type of stuff instead of A, B, C. But what I enjoy about this assessment is that it gives us still the duration of how long someone will be in this stage and the mental age range. And that's important for us to see and remember. So 6A, moderate severe dementia, needs help putting on clothes. Duration 4.8 months, and they're at the mental age of 5. So we have to remember that when mom is taking care of dad or vice versa, that when we are talking to this person, they're at the level of a 5-year-old, not the 86-year-old dad that we remember, but their level. That person is still there, and those memories can be jaunted or excited when you talk about them, but the age of 5 is their mental age. It might not be what they're physically in, but what they're mentally in. 6B, starting to need help bathing. That's 4.8 months and at around the age 4 range. And needing help bathing, they're starting to lose the sequence of things. So you might not physically have to bathe them, but if we remember the 4-year-olds, giving them those verbal cues that we call it as therapists, is giving the verbal cues and then providing the washcloth, saying we wash our face first and then they do it. And then we move our way down and then they do it. So it's the sequencing of events that are going on. Same thing with 6C, needs help toileting. So reminding the person that they have to use the toilet. Part of our brain tells us when our bladder is full or when we have to do a bowel movement. And that part of the brain deteriorates, and this is why we need verbal reminders. And it might be not that they are incontinent yet, but it means that they need those verbal cues. Here's the bathroom. Here's the toilet paper. Don't forget to reach back and do it. Let's wipe again, those types of things. And I think a lot of people that I see, people with frustration, is that they send mom into the bathroom and they keep asking, are you finished yet? Are you finished yet? And then they come out and then they're pissed off, or sorry, but they're angry that mom didn't wash her hands and now she has poop on her hands and that type of stuff. And the thing is that their motor patterns aren't as skilled. So they're reaching back maybe with just a couple pieces of toilet paper. Now it gets on their hands. And if you look at the age range of a 4-year-old, they don't remember to wash their hands after toileting every single time. So discussing it and not being angry about it, but maybe having a picture up, don't forget to wash our hands, all those types of things I go over in my dementia program, of the different visual cues that we can put around the house to make it dementia friendly. But this is 6C. 6D, urinary incontinence. So here comes the incontinence. This part of the brain now has deteriorated where our body is just unable to hold it. That muscle might still be there, but the brain talking to that muscle is not there. 3.6 months is the duration, and age level is 3 to 4 years old. So we can't be getting frustrated with our loved ones, because now if you talk to your 3-year-old the same way you talk to your 86-year-old father, you would be ashamed of yourself. Not everybody, but I know. I've been there, done that. Anyways, 6E, moderate to severe dementia. Fecal incontinence occurs. And again, I've already mentioned what happens. Duration 9.6 months, age 2 to 3. So it starts to physically deteriorate, not just mentally. Level 6, we're going to go over the global deterioration scale. 1, may occasionally forget the name of the spouse upon whom they entirely are dependent on for survival. And so I love this little caption, and it says, this guy wears his wedding photo on his apron when he cooks breakfast to remind his wife with Alzheimer's that they are married. And like I said, visual cues are key in life with someone with dementia. And this is very helpful. And then she might remember one day, she might not the next, but it is helpful for him and it's helpful for her. Same thing as being called something else. My father used to call me my mom's name. Hey, Mary Elizabeth. And he'd call me over, and it's because my mom passed away when I was 10, and now that was at the age that she was at is what he remembers. And so he doesn't remember taking care of his kids and doing all that type of stuff. When he was sick, he would just think that I was my mom because that's where he was at. And not to take it personally, it's just what comes out of their mouth, and just allow it to happen. Level 6, still, number 2, we will be largely unaware of all recent events and experiences going on in their lives. So when you say, don't you remember you went to the doctors? They probably don't. At that point, they're not in denial, they're just not remembering. Number 3, retain some knowledge of their past lives, but this is very sketchy. And we've been there, seen that. They remember some things, but not everything. Sometimes they go and believe that they're still 15, or that there are a lot of times women are at the age where they are young mothers. And I've seen plenty of women looking for their baby. Where's the baby? And they're very concerned on taking care of their child. And this is a stressful moment for, I would say, a woman that has given birth and is now seeking that information. Where's the baby? And I go through with what to do with that behavior. and how to support them through that. Not telling them, oh, Mom, you're wrong. This is me. That doesn't help any. Going with what they need is important. Number 4, generally unaware of their surroundings, the year, the season, etc. So obviously this causes anxiety if you're unaware of what's going on around you and you wake up, but also this is why you can't have them pick out their clothing and stuff like that. Number 5, may have difficulty counting from 10 backwards and sometimes forwards. Number 6, will require some assistance with activities of daily living, may become incontinent. So we already talked about that with the toileting, needing some assistance, which means those verbal cues, the stretching, the moving, the helping with getting over the bathtub, those types of things. Will require travel assistance, but occasionally will be able to travel to familiar locations. So if you're with them and you bring them to your brother's house or something like that, they're willing and able to travel to those locations. Their diurnal rhythm is disturbed, which is their sleep pattern or our circadian rhythm. And this is sometimes what we call starting to head into sundowners while people are up all night. And again, with my Decoding Dementia program, we discuss things that we can do during the daytime to reduce that behavior at nighttime. And number 9, almost always recall their own name, so they still know their name, and so which is great because it's instead of coming in and saying hi, if you come in and say hi Betty, then they know that you are talking to them and they feel special and they feel like something's going on. Number 10, frequently continue to be able to distinguish familiar from unfamiliar persons in their environment. And this is important because I want to say, so as an occupational therapist, I go into people's houses or rooms, and they might not know who I am, and I have to explain to them, and I do my assessments, and we go through all these long things, and possibly 3 to 4 weeks later, and I'm coming in 3 times a week, they start to become more comfortable with me and more familiar with who I am. And now I'm the girl that has funds. Oh, you take me to these activities, or you pretty much I pay the special attention. We do exercises. So they enjoy me because they are happy with my familiarity. In this stage 6, there's personality and emotional changes that occur. And honestly, I've seen them occur in all stages. So, and a lot of times the delusional behavior, like we talked about frontal temporal lobe, delusional or Lewy body can happen well before the cognitive problems. So, but anyways, let's go on. So number 11, with these personality and emotional changes, delusional behavior may occur, but they accuse their spouse of being an imposter, or they may talk to imaginary figures in the environment or to their reflection in the mirror. And when we talk in my Decoding Dementia program, we talk about ways to support your loved one while these things are happening. And if they're not in distress, then don't even touch it. Like if they're talking to an imaginary figure in the environment and they're happy as a lark, just let it be. Don't even have to ask questions. Don't have to point out that they're wrong. Number 12, obsessive symptoms. A person may continually repeat simple cleaning activities or repeat kind of like doing anything. Sometimes like picking at their clothing or just continually repeating doing something. And we discuss in my program what to do. Number 13, anxiety. I would say anxiety starts a lot earlier than this, but I didn't write the assessment. But physical anxiety can happen in the part of our brain that kind of tells us not to be anxious because something that we know that's familiar is happening and we're not worried because this is something we know. That part deteriorates. So our fight, fright, and flight part of our brain becomes unable to determine or what's the difference. So I talk about that, and that's a very key part of dementia, is losing that part causes anxiety to almost everything. So how do we reduce those anxieties? But number 14, agitation and even previously non-existent violent behavior may occur. And what can I say? It happens, and I go over how to try to prevent these things from happening. 15, cognitive abula, which is the lack of drive, slowness in thought, and loss of willpower, because an individual cannot carry a thought long enough to determine a purposeful course of action. And I feel like we have all kind of felt this before. If you guys have had COVID or a really bad flu, and you're like 4 days in, and you've been sitting on the couch doing absolutely nothing, you're bored out of your mind, but you don't even have a full thought or sentence, so you don't even want to move. So not that is this is somewhat like that. All right, so now into staging for number 7. And again, this functional assessment staging test separates them. So 7A, severe dementia. Now we're into the severe dementia. I think it was pretty severe before. It should be like severe and very severe. Anyways, speaks 5 to 6 words in a day. And so this becomes, but you know what? There's times where I use a board where someone can point to the words and their needs. So that brain is still in there and can still be firing on some of the days. And they might not be able to speak it, but they might be thinking of it. So us figuring out how to communicate and understand them is our goal, is what you need to do for your loved one. Duration, 12 months. So this happens for a year. Like, people with Alzheimer's live a long time because their body, their heart is still moving, still ticking. Mental age is age 1.25. So now they're, down to pretty quiet. 7B, speaks one word clearly. This can last up to 18 months. So figuring out a way to communicate with your loved one and figuring out their needs is so, so important. Between those two, that's 2 years worth of not being able to speak clearly. So you want to have your loved one understood and be able to figure out ways to communicate. 7C, can no longer walk. Again, this could happen for 12 months, age 1.25. 7D, can no longer sit up. This duration, again, 12 months. So that's another year, age 0.5 to 0.8. And that's our reflexes. That's our body. This is where our body is at. 7E, can no longer smile. So 18 months can happen. So that affect, the facial features, they're still there. Their muscles are not there. Their ability to tell themselves they're happy and bringing it down to a smile is not there. And again, mental age is infant. 7F, and can no longer keep head up. And that's, again, muscles. The muscles are not there to hold the body up. So now what type of equipment do we need? What type of things do we need in order to keep this person comfortable and happy? And these types of things, so when we talk about the different stages, 7, can be stages for Parkinson's, when your body doesn't want to move, where your words are difficult, where your difficulty keeping your head up. But their cognition is still there. So trying to figure out how to make this person as happy and comfortable as possible is important. So we're going to go into level 7 with the global deterioration scale. All vulnerability are lost over the course of this stage. Too frequently, there is no speech at all, only unintelligible utterances and rare emergences of seemingly forgotten words and phrases. So you will hear people la 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 or da 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 making noises, but I wouldn't say it's unintelligible, because their body and their sensory is trying to do something. It's trying to, why do we shake our foot? Because our body is asking to do it. So it's not unintelligible. It's something that their body is needing at the moment. 3, incontinence of urine requires assistance with toileting and feeding. 4, basic psychomotor skills, ability to walk are lost in the progression in this stage. So as we talked about. 5, the brain appears to no longer be able to tell the body what to do. So that's what we talked about earlier. And number 6, generalized rigidity and developmental neurological reflexes are present. And this is important to understand at very end when you're trying to get someone to stand up. They push, push, push. They're pushing back and you say, stop pushing, I'm trying to get you up. Why are you pushing? I'm not pushing, I'm not pushing. So this is their neurological reflex. If we take an infant and we push on the bottom of their feet, there's a reflex that we are checking to see if they're pushing back. And that's what that reflex is doing. And so their body is at the infant stage, but their body is an adult. And their neurological reflexes are at infant stages. So we wonder why it's happening, but that's why. So with this functional staging test, the total duration can be up to 19.8 years. I totaled it up, and obviously it said between this range and that range, but someone diagnosed with Alzheimer's could live up to 20 years. So we have to really, really consider and think about the things that they need for the long haul and how to work within it. So very important. So I have one more examination that I'm going to tell you about. It is a questionnaire, and I'm going to add it as one of your downloads. And it's just called the Mini Mental State Exam, and we use it. It's a piece of paper, and it asks questions like, what's the date, what's the time, various questions, drawings. So it's a questionnaire for cognitive functional deficit, and that's something we have to remember. A score of 23 or lower shows that there's a cognitive impairment. Does not diagnose for dementia, but it can kind of tell you, are you in moderate cognitive impairment or whatnot, but it does not diagnose. And again, we want to consider when and where this test was taken. Again, like with the distractions or the hearing aids or the language deficit, is there something going on? So like I said before, it's very, very important to know everything that's going on before someone is completely diagnosed as unable to take care of themselves. So this was all a lot. This was a lot of information, and I hope you guys were able to gather it. And like I said, you'll get a recording of this, so you'll be able to read through it or listen to it again. But unfortunately, these stages can tell us where our loved one may be, but they don't give us an idea of how to support our loved one with the day-to-day challenges and changes that are going on with the body. Of course, that's where my Decoding Dementia program comes in. And the program helps you understand dementia, how to provide the customary support your loved one needs, how to make day-to-day challenges easier, understand why a behavior is happening, how to predict when a behavior may happen, how to prevent it the next time, or how to stop a behavior from continuing or the intensity of it. And of course, how to reduce caregiver burnout, because that is very important. There are many ways to do it, and different resources and different stuff like that. So I go into that as well. Because we have to remember, a person with Alzheimer's and other cognitive diseases can live 10 to 20 years after diagnosis. So that is a long, long time and a lot of changes that have to be done. And depending on other medical issues that are going on. If the caregiver gets burnt out, that can be a lot of time and money spent in an institution. So the second someone is burnt out, if mom can't do it anymore, we all say, oh, what do we do? Well, we have to put dad in the nursing home. It's the best care for him. It is not the best care for him. There is a higher rate of decline and quick. So many people that we talk to Mom was doing all right, and then we put her in the nursing home, and mom doesn't speak anymore, and depression and a lot of things. Everything's unfamiliar. So you take someone that barely remembers things, and now you put them in a completely different environment. So besides the money being spent, which is usually about $450 a day, the institutions are not the best place. There's no education in there how to deal with someone with dementia. There's education on how to deal with wounds or how to push out medications and how to keep them sedated and how to keep them in bed or in a wheelchair so they don't get up and hurt themselves. But there is no supervision on how to go for a walk or go do some sensory intervention and how to keep the person happy. Sorry, that's my rant. We also have to remember that starting early is very important. We want our loved ones to still have dignity and a sense of self-control and independence. And it's our job now to give it to them when they can't do it for themselves. We have to adapt everything around them in order for them to be successful. If we had a child with autism, we would learn as much as we could about that disease, well, not really a disease, but that change in brain, the differences, what someone needs, the sensory issues, that type of stuff, so our child could succeed the best they can. And that's what we need to do. If they are successful, there's fewer behaviors, less burnout, and an easier way to live for both the person and the caregiver. And a little side note, a high rate of stress and depression causes quicker progression of the disease completely, like I said in the nursing homes. But if someone's depressed and they are bored out of their mind and their brain is not active, then there's a quicker rate of progression of the disease. It's also thought to be one of the many causes for Alzheimer's. So for that caregiver, you don't want to have that stress. Stress creates hormones that builds up in our brain, which causes Alzheimer's. It's not just that one thing that does, but this is what they believe is a part and associated with it. And if we start early and stay consistent, we create a dementia-friendly environment. The more consistent we are, just like children, they need consistency, they need schedules, everything keeps them happy. And this is exactly what someone with dementia needs. They need their caregiver to understand their level and their current abilities and how to take care of them. And we don't want to leave them at bay and think that we can just give mom a pill and everything will be better, because there is no medicine that is going to reverse dementia in the first place. And there are no medicines that are made specifically for Alzheimer's. And every caregiver is desperate for a solution. And the real solution is time and effort in knowing what your loved one needs and creating that environment that they need. It's not taking a pill and it's going to go away. And hopefully it's not putting them in a nursing home where those people don't have the understanding either of someone with depression, or sorry, with dementia. And now this person is on their own in a brand new environment with other strange people and nobody that knows really who they are.
All right, everyone. I hope you were able to learn something new and it was beneficial, and you guys are definitely going in the right direction. Below are all the PDFs and the information. And don't forget to book a call with me. I have a link down below to book a free call so we can see if the program would be a good fit for you. I think this program is great for everybody. Even if you're not a living caregiver, maybe you can give it to your parents. You can learn the information and transfer it over to somebody. It's great for healthcare workers. It's stuff that I used to teach when I was in the nursing home. I'm also doing like a group, not on Facebook, but in my program, we do like a group sessions where we can do some one-on-one calls and ask questions and stuff like that. So we can have some really good support. And I hope you guys join my group, and I'll see you on the other side. Keep up the good work.